Hello, and thank you for joining us for our The Future is Rooted in Reproductive Justice press conference. My name is Aleo Pugh, and I'm the Georgia Communications and Cultural Strategies Manager at URGE, Unite for Reproductive and Gender Equity. I'm also proud to serve as the co-chair of the Reproductive Freedom Act campaign, a collective of RJ organizations working to extend expansive abortion access to all Georgians. This morning, more than 100 people marched up to the Capitol to meet with their lawmaker and advocate for the RFA, oppose so-called crisis pregnancy centers, and affirm the need for maternal health and birthing justice. We'll hear more about these issues during our time together, but first I want to speak directly to our legislators for a moment. For those of you who refuse to meet with your constituents today, I want to be clear. This is not a scheduling issue, it's a values issue. When more than 100 people take time off of work, miss their classes, arrange childcare, travel from across state, and you cannot step outside your office for a few minutes to hear them out, this is not leadership. This is avoidance and negligence. You work for us. You were elected to represent the people of Georgia, not to hide from them when the conversation becomes uncomfortable for you. Avoiding your constituents will not undo the preventable deaths of Amber Thurman, Candy Miller, or Adriana Smith. It will not make crisis pregnancy centers legitimate medical providers, and it will not erase the reality that Georgians came out today to demand comprehensive, compassionate, and evidence-based reproductive health care. If you refuse to listen inside these chambers, know that we will organize outside of them. We will build in our communities. We will educate voters. We will remember who showed up and who did not. And to the legislators who did meet with us this morning, thank you for having the conversation. This is what democracy is all about. The conversations alone are not enough. A handshake without policy change is procedure, not protection. It does not protect families, undo the harm of abortion bans, dismantle fake clinics, or undo Georgia's ranking as one of the worst states in the nation for maternal mortality. If you truly heard your constituents today, then the next step is clear. Support policies that support them. The people who walk these halls today are watching not just what you say, but what you vote for. Today, I'll be guiding us through a series of speakers who will highlight the full range of barriers that Georgians currently face to living dignified lives. A range of issues will be represented, including abortion access, young people's issues, birth justice, and fake clinics. We will conclude with one simple message, that despite our different areas of focus, all of our issues are connected. And with that, I'll pass it off to our first speaker, House Minority Leader and Representative of District 141, Carolyn Hugley.
Good afternoon, everyone. At the heart of reproductive justice is a simple truth. We must trust women. Trust them to know their own bodies. Trust them to make the best decisions for their lives, for their families, and for their futures, in partnership with their doctors, not in spite of them. When we allow politics to enter the exam room, we don't just interfere with the decision. We delay care. We undermine trust. And in too many cases, we put lives at risk. Research has shown that even when legal exceptions exist on paper, families facing life-threatening emergencies are often left waiting, sometimes until near death, because providers fear legal consequences for simply doing their jobs. This is not health care. This is harm. Georgia deserves better. Our communities, especially Black, brown, low-income, and rural communities, deserve access to real, trusted, competent medical providers, not vague laws that leave doctors guessing. Real care, real information, real trust. Reproductive justice means more than a single issue. It means economic freedom, safe communities, access to quality providers, and the dignity to make your most personal decisions without government interference. When we trust women, truly trust them, families do better, community do better, and Georgia does better. Thank you so much.
Thanks so much, Representative Carolyn Hugley. Next up, we'll hear from Danielle Rodriguez, Executive Director of the Amplify Georgia Collaborative.
I'm Danielle Rodriguez, Executive Director of the Amplify Georgia Collaborative. It is powerful to be with so many partners, allies, and fierce community members coming together today. Thank you all for being here. This week, Amplify Georgia released findings from over a year of research with the Center for Reproductive Health Research in the Southeast at Emory University. This research reveals that Georgia's current abortion ban is leading to pregnant Georgians having their critical care be dangerously delayed, denied, and distorted from what medical professionals know to be the standard of care. 3.5 years ago, Georgia began enforcing HB 481, which bans almost all abortion after about 6 weeks of pregnancy. The anti-choice extremists who passed this law said they would avert the worst of its consequences by having exceptions in the law for people they deem deserving enough, people whose lives are at risk from continuing their pregnancy, those who are pregnant due to rape or incest, and those who are suffering a miscarriage or stillbirth. Well, our research team heard from patients, providers, and others familiar with healthcare access around the state about what's really happening for people in these situations. Some of this may be difficult to hear if you or a loved one have been there too. We heard about stories like Mary's. She had a heart condition that both her and an OB and cardiologist said would be life-threatening if her pregnancy continued. But the hurdles to approving a needed abortion under the law were too high, leading to weeks of delay, and Mary still not having access to life-preserving care. Then there were people like Tina. Tina was turned away from 3 different healthcare facilities while suffering a pregnancy loss. Back at home, Tina hemorrhaged heavily and passed out from the blood loss. A neighbor took her to the emergency room, and even then it took another 10 hours to receive the care she needed to treat the miscarriage and at this point save her from bleeding out. Mary and Tina are not these patients' real names, but their stories are all too real. Across the state, 4 in 5 Georgians want our government to stay out of regulating our abortion decisions. So we advocates and affected communities knew from the start. Can y'all hear me? So we advocates and affected communities knew from the start that an abortion ban was wrong, that it would have dangerous and unjust consequences, that it would fall hardest on people who already face bias and barriers when navigating healthcare and legal systems. These research findings add to the growing evidence that you cannot make a healthcare ban acceptable by editing its fine prints. The bottom line isn't only that exceptions don't work, it's that there's no safe way to silo abortion care from the rest of the pregnancy care. No safe way to legislate criminal restrictions on care, period. This includes the 6-week abortion ban and fetal personhood laws known as HB 481, and over a dozen other laws that the legislature passed before that. Laws that will still contend with that have never served to protect pregnant patients, but only to push good quality care farther from reach. And all of this, while families across Georgia are trying so hard to get preventative health care, safe and equitable birthing care, the support we need to keep our children fed, housed, educated, and healthy. The state has got to stop punishing pregnant Georgians and those who care for them and actually start helping them to thrive. Today, we're here to push for the passage of the Reproductive Freedom Act, which would repeal medically unjustified restrictions on abortion care, expand access to care for all Georgians, and stop criminalizing abortions and miscarriages. In the light of Georgia's ongoing maternal health crisis, it is unacceptable that this bill has been in our state lawmaker hands for 3 years and has yet to receive a hearing. We are all also here to advocate for a full breadth of reproductive justice policies through the 26th Reproductive Justice State Policy Agenda, which is being released today. This policy agenda includes specific pieces of legislation that, if enacted, will realize all Georgians' rights to have a child, to not have a child, to parent the children we have in safe and sustainable environments, and to have our own bodily autonomy. This includes policies to expand Medicaid, to ensure all people can access fertility care, to prioritize maternal mental health, expand access to midwifery care, and enable Georgians to access affordable housing and our immigrant neighbors to be protected. Reproductive justice teaches us that we cannot separate these issues because our lives are intersectional and reproductive justice leaves no one behind. Our communities have come together for all of this because you cannot carve out our thriving from the well-being of Georgia as a whole. And it's time, past time, for every Georgia lawmaker to get with the agenda. Let's make it happen.
Thank you, Danny. Next up, we'll hear from Nelly Vivaldo, co-president of the Power and Protest Society at Wesleyan College on behalf of URGE.
Good afternoon, everybody. My name is Nelly Vivaldo, and I'm a senior at Wesleyan College studying history, politics, and global affairs with a double minor in Spanish and pre-law. I'm proud to be here today with URGE and so many other reproductive justice organizations at the Georgia State Capitol. As a young person and a student of Georgia, we're not here just to advocate, but to have conversations about reproductive justice, about gender equity, and what it means to care for our communities. Continuing to be involved in Advocacy Day this year, today has shown me what advocacy can look like when dialogue does happen. I was able to speak with my representatives, Demetrius Douglas and Gail Davenport, the people that we elected and trust to represent their constituents. Having those conversations, even when they were challenging, reinforced that democracy doesn't stop at voting. It continues when people show up, ask questions, and stay engaged. For many young people, this is our first experience navigating spaces like this and learning that democracy requires persistence. I attend an all-women's college here in Georgia, where access to basic resources like contraception, hygiene products, and health information directly affects students' abilities to succeed. When access is protected, it allows young people to learn, plan their futures, and take care of themselves. Being part of URGE has helped me understand that reproductive justice goes far beyond abortion. At its core, it's about access to health care, maternal care, and information people need to make decisions about their own lives and bodies. These are things my generation depends on. That's why today we're naming legislation like the Reproductive Freedom Act, the Pregnancy Center Fraud Prevention Act, efforts to end public funding and misinformation, and resolutions that support healthy pregnancy and parenting, as well as restricting ICE from going into churches and schools. These are the policies that shape the world young people are inheriting. These conversations aren't always comfortable, but discomfort is not a reason to disengage. In fact, it's often where learning begins. Democracy depends on our willingness to protect space for dialogue and listen across differences. Our voices belong here. Young voices belong here. And when we are given the opportunity to speak and be heard, it strengthens our democracy.
Yes.
Thank you.
Thank you, Nelly. Next, I'm introducing Sylvester Pierce, founder of Younity Birthwork.
Peace, everyone, and thank you so much for allowing me to be in this space. My name is Sylvester Pierce. I'm a full-spectrum certified doula with Younity Birthwork. I'm also a CPR, first aid, BLS, and stop the bleed instructor in the state of Georgia. I say all those things because the fourth pillar of reproductive justice is the right to be able to have children and then to put them in sustainable places where we have safety. Georgia often looks at safety as something that's relative, and it's mainly because those who are in safe spaces do not care about those that they've made crucial and critical places for. And I say that because In Georgia, we have over 90 fake clinics that they call crisis centers for abortions, giving this fake idea of what help is. If the funding that went to those fake clinics actually had clinics that were accepting and continuing reproductive justice, we wouldn't have the crisis that we have here in Georgia right now. Over 80% of the maternal deaths that we have in Georgia are after birth. That's in postpartum care. That means that birthing people are going into hospitals. They're not being addressed properly. Their voices are not being heard, and then they're being sent home. They are preventable deaths that happen. The reason those preventable deaths keep happening is because these pillars of reproductive justice are not being addressed and not being honored. When that space is there, those doulas and midwives, the birth workers that we have in our communities, these amazing people that I have here behind me are the ones that fill in the spaces and the gaps that Georgia leaves open. With that said, I want to talk about two bills that we have. One of them is SB 308, which requires Medicaid coverage for postpartum, meaning after birth, postpartum mental health care services for 1 year after the end of pregnancy. I will also make it very clear that postpartum care is forever after the person gives birth. It's not 6 weeks, it's not 6 months, it goes on for the duration of that person's life. And it also affects the family members that are around them. With that being said, I look at every person that gives birth any type of way they choose to or not choose to as someone who needs postpartum care. Doulas are the ones that help provide that. And with all the $2 million that goes to these clinics every year that can be distributed other ways into the community in Georgia, I'll talk about HB 1264, which creates a pilot program to provide Medicaid coverage for doula care service for pregnant Medicaid recipients, meaning the doulas out here that can get money, those that are working in the community unpaid, can now receive resources to help the families that need it most. I know Georgia's not doing everything that they should be doing to support the families that we have. I ask you to make sure that you are also not being a barrier to the support that the people need. We have the tools behind us. Let's reach into our toolbox and help solve these problems. Thank you.
Thanks, Sylvester. Next, we'll have Senator Harold Jones II, Senate Minority Leader of District 22.
All right.
Good afternoon. Thank you. It's my honor today to stand with such strong women and men who are actually making the stance to have reproductive health in Georgia. The facts facing us are very clear. We're standing at a crossroads where we're either going to choose reproductive health and freedom for every Georgian, or we're going to choose to continue to go down the road where we do not have that, but at the same time have one of the worst healthcare systems in Georgia. The failure is easily traceable to the lack of health care for women. Quite frankly, it is clear that over and over from state to state, where women's reproductive choices are basically stopped, what we find is that maternal health also lags. What we find is that child poverty is high. What we find is that average poverty for all people is high. And what we find is that health care for all residents is also very low. And those facts exist in Georgia. The facts are that our child poverty rates are higher than the nation. The facts are that our healthcare system is one of the worst. The facts are that our poverty level in general is higher. And the facts are that we are actually repressive towards women's healthcare rights. So if we actually want to improve all healthcare, if we want to improve all metrics for all of our people, the key is making sure that you do not stand in the way for women's healthcare rights. Because once you do that, you realize that you do not care at all for anyone's rights. When you determine what a woman can do with her own body, you are basically stating that it does not matter what anyone does as far as health care is concerned. You take a blind eye towards child poverty. You take a blind eye towards poverty in general. You take a blind eye to health care in general. And Georgia's proven to be blind. So at this time, it is our choice to make. Either we're going to give women reproductive choices, or we're going to continue to oppose them. Are we going to continue to oppose women's reproductive rights, or are we going to actually make a choice to improve health care for all of our citizens? The choice is clear. It has been one that has been facing Georgia for many years now. And unfortunately, we have been failing in making the correct choice. But I stand here today, and the folks behind me stand here, and they say loudly and clearly that their choice is reproductive rights for women, and their choice is to make sure that health care is improved for all people. And that is where we must stand as Georgians, and we must stand as the state Senate and state House, and make sure that we stand up for women, and make sure we stand up for health care in Georgia, and we must start doing that now by passing legislation that would do that. Thank you so much. Thank you.
Thank you, Senator Jones. We'll now hear from Agbo Ikor, Policy and Advocacy Director of Spark Reproductive Justice Now.
Hello and good afternoon. My name is Agbo Ikor, and I'm the Policy and Advocacy Director at Spark Reproductive Justice Now, an organization that uses grassroots organizing, advocacy, and arts and media to change policy and shift culture for Black women and young queer, trans, and gender-expansive people of color in Georgia. I also chair the Fake Clinic Suck campaign, a long-term effort to address a particular crisis of care in our state, the harmful fake clinics in our state. I'm here today to speak about our work. I'm honored and grateful to be up here representing this campaign and the incredible work these organizers have done over the past few years. Fake clinics suck. These facilities lie to pregnant people about the reproductive health services that are available to them. They don't offer abortion referrals, or contraception. They only seek to prevent people from accessing abortions, often through shaming and deception. This is a barrier to care, and it harms people, period. The campaign has introduced an important piece of legislation that aims to prevent fake clinics from lying about the services they offer. The Pregnancy Center Fraud Prevention Act, HB 488, SB 196, aims to prevent these facilities from lying to patients and clients about the services they offer. Furthermore, these facilities are tragically being funded by our tax dollars. Every year, these fake clinics receive millions in taxpayer dollars, while Georgia ranks among the worst states for maternal health. That money should be funding real care, not deception. Repealing that funding is one step in mitigating the harms of anti-abortion centers in Georgia. We hope to pass the End Public Funding of Misinformation Act, HB 489, SB 197, which would end the misuse of state funds by fake clinics and repeal the grant program that currently allocates about $2 million a year to them. Lastly, the Fund Healthy Pregnancy and Parenting Resolution, HR 274, SR 207, aims to redirect those grant funds to the Georgia Home Visiting Program, a program that provides home visits during pregnancy and early childhood to improve birth outcomes and decrease infant and maternal mortality. We urge our lawmakers to support these pieces of legislation, and we urge the public to reach out to your lawmaker and ask for their support. Thank you.
Thanks so much for everyone who spoke today. I'm going to close this out. We have such an amazing group of organizations behind us today. We had 25 organizations. And although our core issues that our organizations stand behind may differ, we are united by one clear message: our fights are inextricably linked. Because when we look closely at the forces closing in on our communities, we see that they have the same posture, are exerting the same force, and have the same investment in stripping our communities of bodily autonomy. But what those fixated on the decisions we make about our bodies fail to realize is that their coordination doesn't just make them stronger, it also paradoxically reveals what reproductive justice has taught us for decades: that our liberation is interconnected and our power grows when we organize our communities accordingly. And bodily autonomy, the right to self-determine what happens with our bodies, our lives, our health, and our futures without stigma, coercion, interference, or criminalization, that's what binds us together. The same communities targeted by abortion bans are also fighting against attacks on voter enfranchisement. The same communities fighting for gender-affirming care are refusing the notion that healthcare quality and availability should be dictated by your zip code. These attacks are coordinated, so our resistance must be coordinated too. And one way we can coordinate our resistance is by throwing our full weight behind bold policy change that will ensure all Georgians can live with dignity and exercise their bodily autonomy. That is why we need the Reproductive Freedom Act. The Reproductive Freedom Act repeals, enshrines, and expands abortion access. It confronts the restrictive, dangerous, and undignified conditions in Georgia that have already cost lives like those of Amber Thurman, Candy Miller, and Adriana Smith. They should still be here. The RFA repeals the medically unnecessary restrictions that harm us, including the state's 6 and 22-week abortion bans. It repeals fetal personhood laws and mandatory waiting periods, and it ends the requirement that only physicians can provide abortion care. And the RFA is not just corrective, but it's also proactive. It enshrines our right to make our own reproductive decisions without government interference so that every pregnant Georgian can decide whether to continue or terminate their pregnancy. And it doesn't stop there. The RFA also expands real abortion access by ensuring young people can also get the care that they need. It expands insurance coverage. It moves us collectively from a mindset rooted in scarcity and punishment to one based in access and dignity. As the co-chair for the Reproductive Freedom Act campaign, I get to work with many of the amazing organizations standing up here with me to move this legislation forward. And I do this because I know what all Georgians deserve. But I also support it because it sets a precedent. While the RFA on its face is about abortion access, it represents so much more. This legislation has critical stakes, fundamentally asking lawmakers, are you going to side with ideologically motivated legislators or with the people? The values embedded in the RFA, trusting patients and providers, removing criminalization, and centering those most impacted, offer us a blueprint for what governance can look like. Thank you. And I'll turn it over if there are any questions.
This clear.